Tonight, a Georgetown father is fighting to bring his 10-year-old son home from a New York City hospital. Riker Stipik suffered a brain aneurysm while visiting New York last month, and he's been there ever since. His family wants to move him to Dell Children's Medical Center here in Austin, but their insurance company denied their request for transportation. KVUE's Isabella Basco joins us now in the studio to share what to do if families find themselves in an unhappy, sad situation like this one. Isabella?
Well, Quita, ever since Riker suffered that brain aneurysm in New York last month, his father says there's been very little normalcy for their family. Right now, he says they're in limbo, not having the chance to return to Central Texas. To mark Riker Stipik's 10th birthday early last month, his family went on what was supposed to be a celebratory trip in New York before Riker suffered what his father David calls the worst headache he's ever had.
His arteries and his veins in his head are kind of mingled together, and there was a rupture inside of that that caused a brain bleed, and that's what caused that pain. And so since then, he has been in the pediatric ICU.
Since then, Riker's been in a hospital room in New York, while their family's medical insurance, Blue Cross and Blue Shield of Texas, is covering his care. But the family is running into issues with getting Riker transported and having his medical care covered at home in Texas.
What we've been told is that it's not medically necessary to move him, right? That they consider it a medically lateral move. He is receiving what they've said is comparable or higher level of care at the current hospital than he would coming to a hospital in Austin.
KVUE News reached out to Blue Cross and Blue Shield of Texas. A spokesperson says the company does not comment on member cases. David says the insurance company isn't considering the support network Riker's hometown can provide.
That's going to be a negative impact to our family. It's already a negative impact to our girls to have mom and dad have been gone unexpectedly for so long.
Patient advocate Belinda Montgomery says this situation doesn't surprise her.
Insurance is not very well regulated as far as what the client might want versus what the insurance might want. So automatically things are denied the first time they come through. Keep appealing. You can appeal multiple times. It does take a really long time, unfortunately.
David says they are starting their third appeal with the insurance company.
There is more than just mom and dad in an unfamiliar hospital room and things like that, that there is some level of comfort that's brought back to him during his recovery.
Hoping to bring their son closer to home while he recovers. And the patient advocate we spoke with has offered to give advice to the Stipik family on their situation. For more information on those resources like hers, visit KVUE.com.